Now to hear from Diana Jones, who is a clinical radiation oncology nurse from Queensland Health, and Di is going to be speaking to us about her work in glioma carers, assessing the individual needs and support. So over to you, Di.
Okay, so thank you. Thank you, Harriana. As I said, my name is Diana Jones, and I'm a radiation oncology nurse at the PA Hospital in Brisbane. Now, as part of my role, I look after patients with high-grade glioma and their carers. And the impetus for this study came from recognising the burden that my carers were experiencing, managing not just the patient's physical and cognitive deficits, but also behavioural and personality changes, and managing the wider impact on the carer and the family in terms of caregiving demands, family functioning and distress. What we also recognised, though, was reviewing carer needs currently occurs in a very ad hoc fashion, what I call a corridor catch-up, and is not done consistently and equitably for all our carers. So to improve carer support, I started this as a master's project and now a PhD under the supervision of Professor Ray Chen and Dr. Matthew Wallen from Flinders University and Dr. Mark Pinkham from the PA Hospital. From our initial research, we looked at the needs of carers and what barriers to support existed. We then reviewed previous studies in a systematic review and found a gap in the research in that there were no studies that addressed these diverse needs and barriers to support, specifically in the radiation phase of treatment. Why target this time point? We know that the first weeks after diagnosis and surgery is a steep learning curve as patients and carers seek to understand the diagnosis and adjust to any disease-related or neurosurgical changes. We also know that timely education and upskilling of carers is a proactive measure that can help build carer competence, confidence and preparedness to care. And finally, we know that once carers get enmeshed or bogged down in caregiving tasks, it's hard for them to prioritise seeking help, either to help them care or to help them self-care. So from these learnings, we've developed the GAINS study. GAINS is a pilot study of a nurse-led, carer-driven intervention initiated at the start of the patient's radiation treatment. We aim to recruit 20 carers at the PA over 2023-24, who will complete an initial needs assessment, after which I will meet with them individually to offer support to manage the identified needs. The assessment tool we're using is the Caregiver Needs Screen, which is the first screening instrument developed specifically for neuro-oncology caregivers. We've adapted this tool to add an any other issues question, and a second which will prompt carers to identify their priority areas for support. Sessions will be at a mutually agreed time with the option of face-to-face or by phone, depending on carer preference. The intervention will be offered every 2 weeks during radiation treatment with the option of more or less depending on carer preference, and an optional session and then 4 weeks post-treatment. I'll feed back to the treating team any relevant caregiving issues that are identified, and any resources that are supplied will be from validated sources, including EverQ, Cancer Council, palliative care and carer organisations. Outcome measures will be completed at 3 time points: baseline, end of radiation, and 6 weeks post. The research questions we're addressing are: what's the feasibility of GAINS in terms of recruitment and retention rates? What's the acceptability of GAINS? And we're looking at this from 3 perspectives: that of the carer, the patient, and health professionals in the patient's treating team. And then thirdly, what are the potential effects of GAINS, in particular on preparedness to care, confidence and competence? Data will be collected using a number of validated tools, as well as surveys and semi-structured interviews. So to summarise, GAINS is a tailored carer support strategy initiated during radiation treatment, and which aligns with the optimal care pathway for people with high-grade glioma. In GAINS, we hope to build preparedness and confidence to care, but also to build carer recognition of the importance of self-care and building carer confidence to ask for help, because asking for help is hard, but getting help is considered a blessing. Thank you.